Number two, not all gallbladders that have stones in them need to be taken out. There are so many people. I mean, the gallbladder, we have a gallbladder for a reason, right?
We
And
do.
if
Yeah.
if you can keep your gallbladder, that's better. Obviously, there's many cases in which it's got to go. Person with recurrent biliary pancreatitis, it's got to go. I'm not going to
There
argue
are
with that.
cases, yes. Yes.
But I would
However,
say a large majority of the patients that I've had in what I do, of course, I'm not a surgeon, but in what I do, we have looked on to see if we can get the gallbladder healthier so it doesn't have to go, or is it really something else that's causing the symptoms? Because I've had so many patients where their symptoms were exactly the same before and after gallbladder surgery. And so, and it's not that the surgeons are trying to be malicious. It's just that that's
no.
the tool that they have. And so they try to help patients, but it's not always the right intervention.
Welcome to Take Back My Brain with Laurie Hammer, where real healing starts in the brain. I'm Laurie, a functional nutritionist and mom who's walked the path from anxiety and burnout to clarity and calm. Each week, we're going to dive into brain-based tools like amino acid therapy, gut health, fasting, and faith to help you reclaim your energy, emotions, and sense of self. Hello, everyone. Welcome back to Take Back My Brain. I'm your host, Laurie Hammer, and today we are going to dive into the gut. And we're going to talk a lot about SIBO and all sorts of other gut stuff today. I have with me Dr. Monica Jauregui, and I am so excited that she's with us today. She is a specialist in internal medicine from LSU. She's board certified in internal medicine. She is a functional practitioner and so much more. Dr. Monica, welcome to the podcast.
Hi, thanks so much for having me. It's something that I've been looking forward to.
Awesome. Yeah, I've been excited to have you on. I was on Dr. Monica's podcast, like 2 months ago or something? I can't remember, but
Yeah.
it was just released. So everybody go ahead and look for that, and that'll be in the show notes as well. But how did you kind of switch from traditional medicine into this world of gut health?
So as you said, I was trained as an internist. I finished my residency in 2011. For the first decade of my practice as a real doctor, I was a hospitalist. So I took care
Oh,
of, the sickest patients that would come in through the
mhm,
ER, be it for pneumonia, hip fractures, acute gut issues. And I loved what I did
mhm.
because I was definitely seeing patients at the point where they needed medical help the most. And it was, somewhat glamorous, let's say, to be able to turn people around so quickly and be able to discharge them. And they did a 180, they got so much better. But what I realized is that most of these patients just ended right back in the hospital. A lot of
Right?
patients with COPD that continued to smoke or uncontrolled diabetes that didn't know what to eat. So I really wanted to change my professional approach to something that I felt more was healing and not just
Mm,
temporarily making things better so people could go back it out in the community. At the same time, in 2019, I started suffering from multiple symptoms like fatigue, GI symptoms, pain all over my body that
mhm.
my doctors just couldn't figure out. And they did quite a few studies on me, and finally they just told me to go to a psychiatrist. So I wanted to understand how to make my own body healthier,
Yeah.
but at the same time, I also knew that there was so much more to helping patients than just what we do day to day in conventional medicine, and that's when I found functional and integrative medicine. I got certified through IFM, started seeing my own patients in my own practice, and since then, I've continued to take lots of different courses because when we start going into functional medicine, yeah, we do get some patients that are pretty straightforward, like, okay, these are the lifestyle things you need to do.
Right.
But there's other patients that have been very chronically ill, and it's a lot more complex to figure out the root causes and how to help them eventually heal. So I've been through quite a few courses. One of my favorite things to treat is the gut. It's not the only thing. I see patients with anxiety, with hormone issues, with toxicities, but the gut is something that it's extremely common, and
Mhm.
even in patients that come to me, let's say for a migraine, I'm still going to talk to them about their gut and their gut health because
Right.
that is where most healing starts.
Hey, friend, just a quick break to remind you if calming your brain is the missing piece in your practice or in your home, my Mind Thrive certification course teaches you exactly how to do that with targeted amino acid therapy. So it's real science, real results, no band aids. Enrollment is now open. Link is in the show notes. So back to the show. Oh, absolutely. For sure. There's so many different labels we would put on like gut dysfunction. So there's like SIBO and IBS and leaky gut and like Crohn's, colitis, celiac, all those different things. I would love to tease some of those out so you can like really define those for people so they understand kind of what's the difference between SIBO and IBS. Like let's start there.
Yeah. So that's a great question, and I will start by saying that when somebody goes to a conventional doctor, because I hope everybody out there has their primary care doctor is somewhat in contact with medical care because it's necessary, right? They will, if you go with a gastrointestinal symptom, sometimes they'll get to a diagnosis and be like, oh, you have Crohn's disease, you have
Hmm.
ulcerative colitis, you have Helicobacter. And that is a diagnosis that we know exactly what's causing the symptoms, be it diarrhea, pain, bloody stool, bloating, whatever. And the conventional medical model has quite a bit of things they can do. If you have one of those diagnoses and come to us integrative functional clinicians, we have even more that we can do just
Hmm.
to make sure that your nutrition is good, that your immune system, microbiome, but at least you're getting some sort of real diagnosis from a conventional doctor. Whereas there are a whole set of diagnoses that aren't really diagnoses, they're just describing symptoms like
Right.
functional dyspepsia and irritable bowel syndrome. Those are not their diagnoses because that's the only thing the doctor can put in the chart because they don't know what's causing it.
Right.
But it just means something's wrong and I don't know what it is. And to me, it kind of feels like victim shaming. Well, it's like, your gut is irritable, right? What do you want me to
Right.
do for it, right? And so it's extremely common, even in those patients who haven't heard the term or been told that they have irritable gut or irritable bowel syndrome. It's estimated that 30, 40, 50% of the population probably would meet the criteria if they
Yeah,
looked
for
strictly at the
sure.
criteria, but we're not all, always telling our doctors, like, I have some abdominal issues. If it's not something that's severe, sometimes we don't really discuss with the doctor. We don't always get that diagnosis, but it's extremely common. And it's becoming more and more common as our food source is less natural, has more pesticides and all that stuff. So, again, you get a diagnosis that's a real diagnosis. Great. Please follow what your doctor says. If you want to come to an integrative functional doctor, we have more that we could add on to that. And sometimes even put people in remission for diagnoses that
Hmm.
are, um, you know, severe, like ulcerative colitis and Crohn's. If you've been given a diagnosis or you suspect that you have a diagnosis that is not a real diagnosis, like irritable bowel syndrome, which just means the doctor's like, I don't know why you're having symptoms. It could be constipation, it could be diarrhea, it could be bloating, could be not enough appetite. It's like basically anything that goes on in the gut that we don't
Yeah.
have a specific, that we can't nail down the specific reason. It's called irritable bowel syndrome. There are some criteria, but in general, it's just a wastebasket term. And so when those patients come to us who are root cause clinicians, trained in functional integrative medicine, be it an MD like myself or a naturopath, a nurse practitioner, there's a lot of different people who practice this type of functional medicine. We will sit down with the patient, take a much deeper history, and not only nail down exactly what the symptoms are, because obviously if somebody's presenting mostly with diarrhea or mostly with constipation, they'll both be called IBS in conventional
Sure.
medicine, but
Right.
the
Right.
what it
But
probably
they're
is, it's
very
always very
different.
different. Yeah. And so we take a long history as far as when did this start, what's triggering, what are you eating, what's helped, what hasn't helped. But we'll also try to pin down like exactly what part of the GI system is messed up. And everything's integrated, right? Like you have to be chewing your food enough to be able to digest it.
Hmm.
Your esophagus has to work. The stomach has to make enough stomach acid. The small intestine has to sure that it's absorbing everything. And the large intestine has also absorbs mostly the water, has the most of the microbiome in there. So most of the time we can determine what part of the GI system is affected. And what we see extremely on almost a daily basis in the type of practice I see is that when somebody comes in with the diagnosis of irritable bowel, many times we find out that it's SIBO. And SIBO is one
Mm,
of those diagnoses. It's a real diagnosis. It means
right.
small intestinal bacterial overgrowth. And actually, this is very well accepted in conventional medicine, but it's extremely underdiagnosed. SIBO
Okay.
might present in many different ways, so that's why it's so difficult for conventional doctors to think of this diagnosis sometimes. And so sometimes it's just diarrhea, sometimes just constipation. Most of the time there is some bloating. And so when we figure out if it's SIBO, then we don't just say, "Hey, it's irritable bowel. I don't know what to do about it," or maybe
Mhm.
take something for gas, right? We're
Right.
like, "Okay, we know what it is. We'll try to figure out the subtype." There's several subtypes, and depending on that, we have very well-studied, targeted treatments that have extremely good uh, prognosis, very good outcomes as far as
Outcomes.
how they respond to treatment. So you go from having a diagnosis of who knows your bowel's irritable to, hey, I know exactly what's going on. I know exactly how to treat this. And so to a lot of patients that have suffered sometimes for decades, it's such a breath of fresh air to be like, oh, I'm finally getting some answers
You're
and I
not
have a
crazy.
plan. I know,
Mhm.
right? It's
Yeah.
not just in your head that your gut's all messed up, right? Because some of these patients will have diarrhea one day, constipation the next, and
Yeah.
so
Yeah.
it's really hard from the conventional model to figure out exactly what they have. There are other intestinal issues that can be the cause of irritable bowel syndrome, but I focus a lot in SIBO when I'm educating patients just because that does seem to be one of the most common reasons. And until we address that and rule that out, we typically don't go hunting for other things. A lot of people say, "Oh, I think I have parasites." Well, you know what? Most of us have parasites because
Mhm.
they've been part of the human ecosystem for millennia. That just because you have a parasite doesn't mean that you're necessarily having symptoms from it. So, just out of how common things are, people having symptoms from SIBO is a lot more common than people having symptoms from parasites, let's say. So that's usually where I try to talk to the patient, do tests, and see if it's SIBO. If it's not SIBO and they have gastrointestinal symptoms, there are plenty of other things that we can look at.
Right. So you were talking about SIBO, small intestinal bacterial overgrowth. You said there were some subtypes. So what does that look like?
So clinically, most people, not everybody, but most people will have some bloating. And that is because what SIBO is exactly what the name says. The bacteria, which are usually good bacteria, they're supposed to live mostly in the colon. But when some of
Mhm.
them migrate up from the colon into the small intestine, there's a lot more raw material there, meaning our undigested food for them to thrive off of. And so they're just going to start growing like crazy because that food that we're supposed to be absorbing, the bacteria are like, ooh, it's a
Thank you
buffet,
very
right?
much. Yeah.
I know, right? Hey, you're giving me all this extra food that I normally don't see in the colon. So they really have a party in people's belly, like my kid used to say when when they were little. Uh, yeah.
Why
So
does
yeah,
that migration happen, Monica?
there's different reasons. What we've seen most commonly is people who have damage in the nerves that innervate the small intestine. So the small intestine, just like the stomach squeezes and the stuff goes down, the small intestine
Mhm.
also has to squeeze for everything to go down. Let's say if somebody has had long-standing diabetes, this is something very well described in conventional medicine. The nerves, just like they can get nerve damage in their feet and other places, the nerves in the intestines
Yeah.
can also get damaged. And so the intestine isn't squeezing as much, and so stuff builds up. The food particles build up. The little bit of bacteria that were able to migrate naturally just stay there instead of being squished out.
Mm,
So damage to the nerves, damage to the wall of the intestine.
yeah.
I've seen a lot of patients with chronic infections like chronic Bartonella and other chronic infections where these organisms actually get into the wall of the intestine and
Yeah.
they just can't function like normal and stuff builds up there. And there's really a lot of times we don't know exactly what caused it, but in the steps that we have to treat it, it addresses different things. The excess bacteria there, the motility, making sure that we're not giving the bacteria a lot of the food that they like to eat. We kind of starve the bacteria with the type of diet that we put patients on. So we don't always find the root of the root, but we have a lot of
Mhm.
ways to treat it, even if we don't completely know every time why the SIBO happened in the first place.
Yeah, fair enough.
Yeah.
So where does gut permeability fall into here?
Yeah. So gut permeability, people know it as leaky gut, but I do like to educate patients that it's called increased intestinal permeability because when you say leaky gut, somebody that thinks they're very scientific might say that's not true. But when you say increased intestinal permeability, it's like, oh yeah, there's like multiple journal articles on that every single day. So that's a proper term just so that we understand each other better. And so that means that between the inside of your intestines, where all the food and then the poop is, right? And
Mhm.
your blood, which are trying to absorb the food, right? From inside the intestine to inside the bloodstream, there's only a one layer of cells that's doing like that absorbing of the nutrients. And so as you can imagine, that layer of cells, if it's damaged, then it just kind of opens up that barrier. Either the cells let stuff in within the cells or between the cells, and that is increased intestinal permeability. So as you can imagine, stuff that's inside your gut is not, it doesn't belong in your blood. And that can be a lot of things. That can be food particles that stimulate your immune system and cause an autoimmune reaction because, let's say, particles of things like gluten and stuff in dairy resemble the particles inside our body a lot. And so it's our immune system is trying to attack these food particles that it doesn't recognize because they're not fully digested and ends up attacking our own body,
Mm.
but also the bacterial particles. And that's what, it sounds pretty gross and it feels bad too. So there's something called lipopolysaccharides, abbreviated LPS, and that's like the little fragments of bacteria. After they've lived their life, they die. They're like sitting there in the intestine until next time we poop and we get them out. But if your gut is leaky, those lipopolysaccharides can get into the bloodstream. And so LPS, we say little pieces of something, are in the bloodstream and they're extremely inflammatory. And so a lot of the diseases that are like, even vascular disease can be traced back to leaky gut to some
Okay.
extent. A lot of issues with the blood brain
Mhm.
barrier does not
Mhm.
let everything through. It's a very closely
Very
guarded, right?
picky.
Our brains are sensitive. And so when people get leaky gut, it just gets so inflamed in all our vessels that the brain sometimes is the first one to have symptoms. So a lot of bad patients with brain fog, even if they don't have gastrointestinal symptoms, I will do things to make sure that we're optimizing gut health. And sometimes that's the main thing they needed, right? Not always, but
Right, right.
sometimes that's the main thing they needed. So that's what leaky gut, increased intestinal permeability is. Stuff goes from the gut into the blood that doesn't belong there, and it causes inflammation and an immune response.
That's amazing. So, like the LPS then, is that am I understanding it correctly that basically like bacterial waste products? It's like when you said the bacterial die, or is it something different?
Yeah, so it's like the wall of the bacteria. So
Gotcha.
yeah, I mean, bacteria, as you know, are replicating super fast, which means they also, there's a lot of dead bacteria, right, in our gut, in our poop. And so it's normal for it to be in the gut. Even if you have bowel
Yeah.
movement every day, you just don't want it to be leaking into the blood stream. And so there's multiple tests for potential leaky gut. There's multiple tests for everything, right?
Right.
In what we
Right.
do. One of them that I don't do on a regular basis, but it is kind of cool, is to see how your body is reacting to lipopolysaccharides. We'll check a blood sample of IgA, IgG against
Mm,
lipopolysaccharides and see how much inflammation is. And so ideally, your immune system would not even know what a lipopolysaccharide is, right? It's like, oh, that's in the gut.
right.
I'm not going to be, maybe just my immunoglobulins that live within the gut take care of that. But when the immunoglobulins that are living inside your blood and all your organs know what lipopolysaccharides are and are reacting to an extreme amount, then yeah, that those are typically our most symptomatic patients. And again, doesn't have to be a gut problem. A gut symptom could be
Sure.
fatigue, could be fibromyalgia, could be brain fog.
And I think that's what a lot of people just don't understand. It can show up very different than, some people with celiac disease, they'll have MS, they have zero, symptoms of gut issues. Like they wouldn't suspect they have
Absolutely.
celiac, but then they're diagnosed with MS and then they find out they have celiac, they have an autoimmune. And so it's kind of triggered that whole process. But it's
Yeah,
just
yeah,
fascinating. So
yeah,
how
for
do
sure.
you prevent like the reoccurrence of like SIBO and IBS? So is there some tips that you could give people and like kind of reassurance? Like if we do this protocol and you stick to it, you're going to feel good 80% of the time.
Mhm. Yeah, so this is something that is still growing. There's more research every day. But what we know until now is that SIBO is something that unfortunately does recur in a lot of cases,
Hmm.
in part because there could be multiple reasons that are causing it, in part because if patients aren't completely, they don't understand what they should be eating, they shouldn't be eating. It's hard to stick to a strict diet, and so sometimes it does recur over and over. And so that when we find it and we treat it, we typically, the first thing we do is tell people stop feeding the bacteria. So bacteria
Right.
like to eat certain types of carbohydrates are called high FODMAPs, and so we put people on a diet that's called low FODMAPs. And so that's the first thing, like kind of try to starve the bacteria. If you're eating nothing but, let's say, I'm not suggesting this, but if somebody eats nothing but meat, there are no
Mm.
FODMAPs in meat, and so they're going to starve the
Right.
bacteria. That's
That's
why a lot of
very
people
low
feel good on
FODMAP.
the carnivore diet, even though it's not
Yeah.
really that good for you. But that's one of the reasons. There's other reasons. But you can eat vegetables as long as you understand which are the high FODMAPs, the low FODMAPs. And once you have healed from SIBO, we do want you to incorporate those vegetables again that are high FODMAPs, but slowly.
Sure.
And so we start with the bacteria. We can give antimicrobials, be it pharmaceutical or herbal. We help the gut with the motility so that it empties and the bacteria
Hmm.
don't accumulate again. But there are a lot of people who have a recurrence. The number one reason that I see a recurrence is because they only do the part where they starve the bacteria and kill it, but forget the motility part. And so there are medications. The one that has the best results in studies is called prucalopride. But there's also a lot of natural things that we can do. Things that contain ginger will stimulate the emptying of our small intestine. Gazillions of different potential supplements out there with different combinations. So making sure that if we've been treated for this or we suspect that we have it, not only do we need to watch what we eat for a while, but make sure that we keep that small intestine emptying. And it has nothing to do with whether you're having a bowel movement every day or you have diarrhea or you have constipation, because that's your large intestine emptying. The small intestine
Right.
can be very stagnant and then you have diarrhea. So you can't just tell by the symptoms. And so that's the mainstay, is making sure that we do that final step in the whole treatment process, which is let's keep the small intestine moving. If you have a
Hmm.
recurrence, it's not the end of the world. It's okay. Each time we go through the entire process of, okay, let's put you on a stricter diet, let's give you some more oil of oregano or whatever antimicrobial that we decide, each time the chances of you going into remission is a little bit higher. And so, yeah, sometimes we do have to work with these patients, not just for a few months and do just one round of treatment. Sometimes we do have to do repeated treatments. And if they fail 2, 3 times, then I'm like, okay, we have not found the root cause.
We've not found the root
Um,
cause. Yeah. And it's hard to know that. You have no idea how the patient's going to respond.
Absolutely. And,
Yeah.
and some people do come already with a diagnosis that I'm like, oh, well, until your diabetes gets better, it's not going to
Right.
get better, right?
Right.
But most patients don't. Most patients, we don't know the root of the root until
Hmm.
we either do some more digging or until they've failed. And we're like, okay, let's go back to the drawing board and say, hey, do you have one of these chronic infections that's affecting the bowel wall? And so
Right.
we're testing things that we can do. But the good news is that compared to the conventional approach of IBS, again, most of those people have SIBO. At least we're telling you the most likely reason why, what you can do about it, and that there are a lot of people that completely heal from this. So it's night and day difference for those people who have IBS and they're just like, well, the conventional doctor didn't give me a ton of stuff to do, maybe a medication to decrease my symptoms a little bit. So that's one of the main things that I love treating because a lot of people can completely go into remission from this.
Right. And I think a lot of people just think they have to live with it forever because that's what they've been told.
And I wonder how many people out there don't even know that it's abnormal to live bloated or to not have
Exactly.
just regular bowel movements. A lot of people out there feel like it's just part of life. I eat and I get
Mhm.
bloated and have a little bit of belly discomfort, but it's not. That's not how your body's supposed to work.
Right. I know people get really surprised. You're like, oh, I'm supposed to poop every day. Yeah,
Yes.
ideally, that would be good. Or I'm not
Yeah.
supposed to have diarrhea a couple times a week. I just thought everybody did. No,
Exactly
that
right. Yeah, I
yeah.
even had people tell me that they had blood in their stool for a few years, never told their primary care doctor because they're like, "Man, I didn't know how big of a deal it was." I'm like, "Well,
Okay.
yes, I'm glad that we know that."
Yeah, I had a guy one time and he literally had diarrhea every single day, multiple times a day, his entire marriage, and they'd been married, I think, 21 or 2 years. And he came to me, he's like, "I just thought that was what my body did." I'm like, "No, no, 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 no." And his wife's like, "That's what I always told him, that that's not normal." We changed his diet. We did some just like super basic gut healing. Within a week, he didn't have diarrhea anymore. Like we just removed the things that was causing it and clearly had other things going on. But it was such a dramatic shift. He's like, I had no idea life could be like this. Like, cause he didn't
Yeah.
do a lot of things because he's like, if I eat, I'm gonna, have loose stools.
Yeah. Yeah, it was affecting his quality of life. And then what I love about what we do is that we heal one part of the body, or not we heal, but we help the patients heal, right? And
Yes.
then other things start to get better, and they're like, "Oh my gosh, my, doctor took me off my depression medication, my anxiety
Yeah.
medication." I've even had people come back from their rheumatologist and be like, "My rheumatologist said I don't need to take the rheumatologic drug anymore for lupus or for." And so
Yeah.
I don't manage those conditions primarily. I let patients continue to go to their specialist, but there are a lot of cases in which people get so much better. Just this week, I had a patient that we were healing her gut, and on follow-up, she had, gotten off amlodipine and losartan, which are 2 blood pressure medications, and she had gotten off glipizide, which is a
Mm,
diabetes medication. And we weren't starving her, we weren't putting her on a harsh diet, on doing a lot of exercise. We were just changing around how she was eating, making healthier choices, less inflammatory things, yeah, a little bit less, of the simple carbohydrates. And yeah, she went to her primary care doctor. Her primary care doctor's like, "Oh, yeah, no, you stop those 3 medications." And when she saw me, her blood pressure was perfect, her blood sugar was perfect off of those 3 medications, and she was feeling a lot better. Not only were her GI symptoms better, but other symptoms like, her muscle aches were better.
oh, that's awesome. Yeah, it's so fun to watch people because you remove those interferences and then the body heals. Like, and
Yeah,
sometimes it's just dietary. Sometimes we have to dive deeper, like if you have SIBO or IBS or something. But yeah, it can be really profound. And that's why I love what I do. And I know that's why you love what you do. Yeah.
yeah,
What
absolutely.
are some things about digestive health that you really wish everybody, including, mainstream medical, really understood a lot better?
Yeah, I think the main thing that I want to tell people is make sure you get a real diagnosis and not just walk away with the label of IBS. Number 2, not all gallbladders that have stones in them need to be taken out. There are so many people. I mean, the gallbladder, we have the gallbladder for a reason, right?
We
And
do. Yeah.
if you can keep your gallbladder, that's better. Obviously, there's many cases in which it's got to go. Person with
Right.
recurrent biliary pancreatitis, it's got to go. I'm not going to
There are
argue with that.
cases. Yes. Yes.
But I would
However,
say a large majority of the patients that I've had in what I do, of course, I'm not a surgeon, but in what I do, we have looked on to see if we can get the gallbladder healthier so it doesn't have to go, or is it really something else that's causing the symptoms? Because I've had
right.
so many patients where their symptoms were exactly the same before and after gallbladder surgery. And so, and it's not that the surgeons are trying to be malicious. It's just that that's
No.
the tool that they have. And so they try to help patients, but it's not always the right intervention. And so I would say make sure that you've explored more options and don't just get a gallbladder surgery immediately. If we can save that gallbladder, and we can't always, it does have its function. It's going to help you absorb your meals better the rest of your
Mhm.
life if you're able to keep it. And other things that I do think are important to make sure that everybody is aware is that everything does have a root cause. Sometimes, especially in the insurance model, both patients and doctors are kind of like in a hurry and they're like, okay, I'm just going to give you something to manage the symptoms. But they don't, doctors in the conventional model just don't have the time. If insurance is paying them for 10 minutes of their time, they don't have the time to sit there and try to figure things out. So, conventional doctors, if you can find a way, if you're in the insurance model, to get to more root causes, either schedule the patient for a longer visit, send them to one of your colleagues, or send them to us. We're still your colleagues, so that we can sit down with them for longer
Yeah,
and get to a root cause and not just manage symptoms.
I love it. Where can the audience find you?
So my website is trulyhealthymd.com. I am, like I said, an internal and functional medicine doctor. My practice is in Texas. I have a Texas license, and so I can see anybody within the whole state via telemedicine. But even if you're not in Texas, I do have a lot of educational material. I have my own podcast. I have my social media where I love to educate. And I want to bring this kind of healing to everybody, even those patients, even those people who cannot be my patients because
Yeah,
of the healthcare laws. I want to continue to educate and make sure that we get the word out that people need to be their best advocates and that true healing is possible.
I love it. Thank you, thank you, thank you so much for being on the podcast. This has been a fantastic interview talking about the gut, SIBO, IBS, and all those good things. So I really appreciate your wisdom and your knowledge and expertise on this area.
Thank you so much.
Thank you so much. And thank you, everyone, for listening and watching. And I know that you know somebody who needs this information today. So I want you to like, subscribe, share this interview. And if you have the opportunity, I would love for you to leave a review. We would appreciate that a lot. Other than that, I will see you in the next episode. God bless. Thanks for listening to Take Back My Brain. If today's episode helped you connect with hope or direction, I want you to follow the show, leave us a review, and share it with someone who needs it. And if you're ready to start your own healing journey, explore our courses and our coaching programs at lauriehammer.com/store. So until next time, remember, you cannot medicate away a nutrient deficiency, and healing your brain isn't just possible, it's powerful.